to the campfire. Tonight we're looking at making safeguarding personal, bringing person-centred care into adult safeguarding. And our focus tonight is a report produced by or commissioned by the Association of Directors of Adult Social Services on the current state of play with regard to making safeguarding personal in England. So I'll very quickly do a round of introductions. My name is Douglas Badenoch. I'm an information specialist and I edit the Social Care Elf, a regular blog about new evidence in social care. And I'd like to introduce the rest of the participants. So I'll hand over to Adi Cooper.
Hi, I'm Adi Cooper. I'm one of the people involved in the ADAS temperature check, which we're going to talk about tonight, but I've been involved with making safeguarding personal for several years. I'm the chair of the adult safeguarding board, a couple of adult safeguarding boards, and I do lots of work around adult safeguarding across England. That's about as short as I can get it. That's
pretty good effort. Thank you very much. Lindsay, would you like to introduce yourself briefly?
Great. Yeah, I'm Lindsay Pike. I'm a Senior Research and Development Officer at Research and Practices for Adults. If I could ask you to bear with me because I use a breathing technique to manage a stammer. In terms of making safeguarding personal, RIPFA has been on the National Advisory Board of MSP for a good few years now. I work as RIPFA's safeguarding lead, and I led on the national evaluation of making safeguarding personal last year.
Thank you very much. Well, we're also expecting a couple of other participants, so we're just sorting out a few goblins in the woodland that seem to be messing with our connections. Andre Tomlin from the Mental Health is here operating the social media feed. And we've gathered some questions today from interested parties, but this is an opportunity for you to tweet your questions for the authors of this very important research. You can tweet live during the broadcast and we will try to answer them at the end. And once we finish this broadcast, we'll be putting the recording on a blog on Social Care Elf, and you can pick up any further issues. This is, it's a very interesting report because this is a big change that's taking place in a kind of culture shift in social care, which is happening at the moment. And these reports are particularly interesting because they give us a sense of where we are now, what the process has been, and therefore what the likely trajectory is in the future. So I was going to kick off, Adi, if I could ask you just to, for people like me who are not experts in this area, what is making safeguarding personal and why is it important?
So what it is very simply is an approach to adult safeguarding practice that is about being person-centred, because with the history of personalisation, safeguarding often got left out as a separate and specialist area of work. So very much it's about thinking about the person at the centre of the process, and that it's outcomes focused. And by that I mean that instead of focusing safeguarding activity on process, it's focused on what that person wants and needs to keep themselves safe from harm or to manage risks in their lives. So we start with what the person themselves thinks is important, both in terms of their safety, but also with the Care Act, their well-being overall. So it's outcome focused and person-centred, and it's an approach to safeguarding practice. It's not a new set of procedures or rules. It's about how how we all do safeguarding in whatever ways that we do it. So very simply, it's person-centred and outcome focused, but it's a lot more than that. It sounds very simple to do, but actually it requires a lot more to achieve because of the way we've been doing safeguarding historically over a number of years.
So this changes come about in response to perceived shortcomings in that very process-oriented approach up to now. Is that correct?
So I think with No Secrets in England, it was really important because adult safeguarding, or as it was then, adult protection, wasn't really on the agenda. So the work that was done at the end of the 90s in No Secrets was very, very important in raising the profile and getting a better understanding of what risks and harms and abuses people were experiencing and how agencies could work together to support people and help them in those circumstances. But what happened was it was very focused on an investigation having an outcome in those terms that was substantiated or not, i.e. has it happened or not, rather than thinking about what the person wants. A kind of caricature of what that might mean is that lots of people went through safeguarding processes without even knowing that it was happening to them, because it was dominated by professionals talking to each other rather than talking to the person and their family network who were at the centre of the circumstance. So making safeguarding personal came out in response to a lot of feedback from reviews, from investigations, from scandals, from the consultation on the No Secrets reform, from what people were telling us through peer reviews and sector-led improvement work the LGA was undertaking, that people weren't even asked what they wanted, weren't being heard, weren't being talked to, and the process was dominating rather than the focus on the person. So it came in response to information and intelligence from lots of different quarters saying, safeguarding isn't quite working in the way really maybe it should, particularly in the context of personalisation across adult social care. And over a period of time, there was some testing of ideas about what making safeguarding personal was about. There was some piloting work that was done in 2013-14, and then in 2014-15 it was rolled out nationally just before the CARE Act. And with the CARE Act, a lot of the principles are in there. The approach is in the CARE Act guidance on adult safeguarding. So as before the CARE Act, it was good practice to adopt a different approach. After the CARE Act, really, it's what we should all be doing, which is adopting a much more personalised and outcome-focused approach to working with vulnerable adults who are going through any kind of safeguarding process, or who are, trying to, ideally trying to prevent them having to even hit that kind of threshold for safeguarding inquiries, to work with people to manage risk in their lives and risks of harm and abuse.
That's fascinating. Well, this is something that's been in the pipeline for a number of years. And this is not just about any specific political framework. This is something that's come from reflection on practice and attempts to make practice more responsive to what people need.
Absolutely, and it's policy driven by what people were telling us. And by us, I mean those, because it's the group of us who have been trying to help people change how they work. And what we know is that a lot of professionals who've involved in working in a different way have really responded positively and appreciated this and have said, well, this is how we want to work, or how we thought we ought to work, but maybe haven't been able to because safeguarding had been so process dominated and procedural that it was more a case of following the process than actually thinking about what the person at the centre might want to achieve as an outcome from safeguarding work.
Thanks very much. That's brilliant. I was wondering if it would be worth, because the temperature check follows on from, this is a biannual survey, if you like, of the current state of play. And so, I wonder if Lindsay, you wanted to comment on what you found in 2014 in the previous report before we look at the current one.
Sure. So we were commissioned by ADAS and the LGA to do a national evaluation of making safeguarding personal, which was the first one which had been done in a really comprehensive way. So we did a a survey to all of the MSP leads that we could contact, which got a reasonably good response rate. I think from memory about 64% or so, but we realized we also needed a broader base of understanding of what was really happening in practice too. So we also did a survey of frontline staff who the leads had told us had been using a making safeguarding personal approach in practice. And we also did a number of telephone focus groups, which meant we got a really good comprehensive lot of quantitative data and also some qualitative, more in-depth, how things are working. And we found that people were really at quite a wide range of stages in terms of the journey to making safeguarding personal working practice. What was really needed was strong leadership that always really helped when the Safeguarding Adults Board was on board as well, good staff learning and development opportunities, lots of space for reflective practice and CPD, and recognizing that it raised some quite challenging questions, especially in terms of good use of the Mental Capacity Act and really supporting people to take managed risks in their lives, because there had been quite a tendency to be quite risk averse and want to protect and sort of make people safe, even when that meant they lost their independence or their autonomy. And actually, if you look at case law, especially case law coming from the Court of Protection, it's mainly when people have been, really, really overprotective and done to rather than done with. So we found that good use of the Mental Capacity Act was really central to good practice in making safeguarding personal too.
Well, that's great. Thanks very much. So this is kind of sets the point at which your research comes in, AD. So there's sort of 2 years.
So can I say it wasn't? I wouldn't call it research. So what we were trying to do, sorry to correct you, it was a temperature check. So RIPFA had done this really helpful evaluation of where we were in the process across England as the whole approach was being rolled out with the preparation for implementing the CARE Act. And a year on, it was thought really useful to find out where people had got with it, because there was no sense of, or very little sense of understanding about what the current blocks and barriers were. After the evaluation that Lindsay was talked about, we all talked to lots of people and about how to shift some of those things, and certainly, say, taking, for example, the Safeguarding Adult Board chairs, which, as Lindsay said, the Safeguarding Adult Boards, in terms of leadership and saying this is the way we think safeguarding should be practiced, is quite important at a strategic level. So, for example, chairs were making safeguarding personal seriously in terms of promoting this approach within their boards. We didn't have an idea of how effective it was being and what the current blocks and barriers might be 18 months on. So the temperature check was also presented in terms of a coaching conversation. So it wasn't a questionnaire people filled in, it was a conversation, a 1 hour long conversation with someone nominated in each local authority, with some questions that were the same as the evaluation done 18 months previously, to try and get some comparative sense of where we've moved. So we was, from A to B, but also to talk to people about what the things were that they were doing. And that's why it was called a coaching conversation, to support people within their own agencies to think about, or to be able to talk about what they were doing in terms of progressing this within their organisations, within their local authorities, but also with partners. The other thing that we tried to do with the temperature check is also look particularly at service user engagement at a more strategic level, and also more operationally, not just in terms of individual casework. So there was some work done trying to get good evidence of good practice, particularly in that area of work, but also in other places. So the temperature check, we talked to 115 local authorities, 76% of local authorities in England, and we had those coaching conversations with team of several of us had those coaching conversations with somebody from each local authority. But what in some cases it was maybe a group of 4 or 5 people, in some cases it was 1 or 2 people, most cases it was individuals, but trying to get some sense of where people were, but also what they were finding difficult, but also how they were resolving those problems themselves. Because what's really helpful, and what we know from the evaluation that RIPFA did, is sharing practice and knowing what's going on elsewhere is really, really helpful in making safeguarding personal. So it was anonymised, but we asked people to give us examples of good practice so that they could be shared across England, and people would say, oh, over there they're doing some really good work, say with people in care homes with safeguarding, adopting, making safeguarding personal approach. We think that's really important. It's something that our board wants to do. Let's learn from them. Let's see how they're doing that. So in completely running through the program from the start is this really important thing about learning from each other and learning together. This is a culture change that will take time, is taking time, but how we help each other to make those changes is really important, the way in which we do it. It's not a competition, it's not a race, it's a culture change that we want people to go on a journey with us all on.
Well, sorry, carry on, Lindsay.
No, I was just gonna chip in, especially because making safeguarding personal is really a sector-led approach. It's been trialled in practice, it's been led by practice, it's not been dictated by government that we must do it this way. It's really grown in a quite organic way, which has led to its inclusion in the Care Act, but you know, it's all been led by practice, and that's why I think it's good to be able to draw on a really broad base of evidence, because of the challenges of both funding and conducting good quality large studies, especially trials in things like safeguarding adults. It's very challenging. So by drawing on a shared experience and learning from what other councils and partners are doing, and sort of trying out in a more sort of micro research or an action research way, that's a really nice way of building up practice, and also makes it much more timely and responsive as well.
I mean that's a great point that you both made about sharing what other people's experiences are and different ways of working. And one of the nice things about the report is that you've got quite a lot of examples in there, and you've also sort of stratified things for local level, regional level, and national level. I wanted to ask: is there, you know, where I guess at a local level, individual people who are implementing MSP, they'll work locally with their own organisations. And what I was wondering if at the higher levels, is there some sort of systematic way in which those recommendations are being taken on board, or where people can access examples of best practice?
So in terms of, before I go on to the 20 recommendations and how they're being implemented, can I just pause and say the key messages that came out of the temperature check were that most local authorities and most partnerships, because we asked not just about what the local authority was doing, but also the Safeguarding Adult Board and other partners in work, because fundamentally adult safeguarding is a partnership endeavour, whether it's at a personal individual level in terms of somebody having different people involved in their lives, or whether it's a strategic level on our Safeguarding Adult Board, which is a partnership of a number of different agencies and organisations, including community and community representatives, that we were looking at how that's progressing in terms of this journey. I'll describe it as a journey that we're on with making safeguarding personal. And I think one of the most positive key messages coming out of the report is that most places are trying and are working on this journey and are moving forward on the journey. And compared to the intelligence that we got from the RIP evaluation previously, where most people, well, a lot of people were saying we can't answer these questions because we're still starting, we're only just beginning. A year, 18 months on, people were saying, oh yeah, we've got a bit of a way further down the line, and these are the issues that we're now encountering. We're starting to get our IT systems to support us rather than prevent us working in this way. We've got it integrated into all our training and our Safeguarding Adult Board training. It's there on our strategic level, in our annual plan. We've got partners thinking about how they're going to work with this within their own organisations as well as with us. So it's I think the key message from the temperature check is that it's a good news story. There's been a huge amount done in most places, not all. Some people have stalled, and that's fine for all sorts of reasons. It's not an easy environment to make change happen effectively, but most places have moved forward, and in itself, the temperature check was a catalyst. I can't tell you how many people said to me, this was so useful because it made us sit and reflect on where we are and what we're doing, and that's so helpful. So in itself, it gave a bit of a catalyst for some people to think about what they were doing. So having said yes, lots of people have moved in a way forward in lots of places, there's also still a huge amount to do. And the key message in terms of where we're going next, I think, is that making safeguarding personal, because of where it's coming from, has been seen and has been developed very much within adult social services and local government, and perhaps those agencies that are closest to it. So say, for example, mental health trusts who undertake statutory duties on behalf of the local authority. The temperature check says very clearly the time is now to make making safeguarding personal everybody's business, to take it out into all our partner agencies, to make it something that is understandable in the languages and cultures of all partner agencies, not just local government. And the door is open to do that. I don't think we're hitting against a closed door. The door is open, but it's making that work and having everyone literally on the same page, moving in the same direction. And so one of the key useful bits for coming out of the temperature check is a kind of pathway for people to think about locally within their own localities. Where are they in the journey, and therefore where might they need to go to move on next? And I think that will be helpful for particularly boards and partnerships to think about what they might need to do in terms of taking this culture change programme forward. So how are we going to support that? So there were three aims from the temperature check. One was to measure progress around implementation. So how far have we gone since the RIPFA evaluation that Lindsay was involved with? The second one was to get information and views from safeguarding leads to shape a programme moving forward, an improvement programme. And the third thing, which I've talked about already, was about offering reflective coaching and advice for those leads within the local authorities. But on that second point, the temperature check came up with 20 recommendations, and they're broken into local, regional and national. And there's a group that I chair and that Lindsay is a member of, which is currently called the Making Safeguarding Personal Task and Finish group, although I don't think we're finishing quite yet. And that's like I suppose a reference group, an interest group of people who are trying to help at a national level support the programme moving forward. And there are some limited resources within the local government association, something called the Care and Health Improvement improvement programme to commission one or two very small pieces of work to help move the programme forward. But quite frankly, it's up to everybody to do what they can within either regional or local settings to make this progress work. So on a regional level, there are regional networks of safeguarding leads, there are regional adult safeguarding people, whether it's chairs of boards or professional leads, who have it within their gift, as it were, to look at some of those regional recommendations and think, how do we in our region work together to maybe move some of these forward? And everyone is at a different position, in a different place on the journey. But for example, at a regional level, sharing information about what works in practice, what we know from the evaluation and other feedback historically is that really helps if someone is struggling to think about or to know that someone next door is working in a similar way and has sorted out a problem. Also, if you have, say, for example, organisations like the police and the health who work across different places, they can see how at a regional level taking some of the work forward makes sense to them. So that's one of the reasons the recommendations are broken down in that way. And as I said, at a national level, the Task and Finish group is trying to help support some of the national priorities moving forward, to try and, help us move another bit way down on the journey. So there is some support coming at a national level, which will help some of the things that people have told us that they need. I'll give you an example. We had people in the coaching conversations telling us that they had or created audio-visual DVDs or films that helped raise awareness or help people who were going through safeguarding understand what they were doing. Now, that's something that we're looking at trying to pull together as a national resource that maybe would go on the Knowledge Hub, which is something that we use to share information. There's an adult safeguarding place. So people can access resources that they maybe didn't know about. There's a thirst. We haven't got resources to, say, make a DVD about adult safeguarding 152 times. We only maybe need to do it once and share it. So that whole philosophy of sharing and learning from each other, just in that very simple thing about sharing an audio visual resource that can, even, you can't, a list of, I don't know, links to things on YouTube, so you don't have to search for them yourself, is something that people would find helpful. So we're trying to do some very simple practical things at a national level, as well as some more sort of strategic things to take the recommendations forward.
Well, that's very interesting. So there should be resources or mechanisms for people who want to see what's going on in other areas, what sorts of resources other people have developed. They shouldn't feel they're doing it in isolation. There are mechanisms whereby they can get access to that information and get the support, hopefully, that they need.
Absolutely. So, as I say, that the recommendations address various different aspects of trying to take the work forward, where those of us involved in the temperature checks thought that we could really help people locally, because at the end of the day, it's people out there on the front line who are doing the practice who need help. But sometimes there are things that you can do that make that job a bit easier.
Mm-hmm. And you also mentioned other agencies there too, and that was something in the report that, as in some settings, the levels of engagement, if you like, with in-person centred care with other agencies was patchy, and that's one area where some people felt there was a stumbling block, if you like, or certainly there were challenges. And we've had a couple of questions from Twitter from people who work in mental health professionals. And I guess this is there are probably quite a lot of factors involved in that. Perhaps they're not as aware of this this agenda. They may well use different IT systems or different policies and procedures. Are there any kind of particular parts of the report you could point to that would help folk who are trying to get a sense of, you know, if I'm working in, as a mental health professional, how can I support this agenda? How can I find out what's happening where people are locally, and how can I take it forward?
So I think it's really interesting that that's been raised as an area that may be problematic. So, as I said, one of the main messages coming out of the temperature check was that this approach to make safeguarding personal needs to spread out of local authorities across all partners. One of the issues for me around how that relationship might be particularly played out with mental health providers is around their roles and responsibilities in relationship to undertaking safeguarding inquiries, which is quite a formal part of the process, where there should be very clear expectations that this is the approach you take when undertaking safeguarding activity. For somebody who's working in any organisation or in any context, my first point of my first point of direction would be to look at what your Safeguarding Adult Boards is saying, because that's where the senior leaders of all the key partners in your locality should have adopted and signed up to an approach to safeguarding practice. And one of the things that the evaluation said was that Safeguarding Adult Board leadership and senior managers, Lindsay can correct me if I'm wrong, need to give people permission to work in this way. And it's really, really important, because giving people permission to do something that is maybe a bit different to how they've worked previously is also making sure that people don't get blamed if something doesn't work out in quite the same way as expected. And that permission is what a Safeguarding Adult Board can do and should be doing by saying, yes, this is the approach we want everybody in our locality to adopt. I think it's also complicated by what might be the custom and practice in a particular organisation and institution, and where you're coming from and you're working with, and whether there are people within your organisation that will support you. So another key finding over all the time we've done making safeguarding personal is how important supervision, reflective practice, managerial support for frontline staff is in terms of helping this culture change shift. There's no point having a really different approach to practice as a frontline staff if your management or your supervisory approach is going to prevent that from happening or not be helpful. So I don't know if that addresses the questions that have been raised, because I'm not quite sure what the specific problem and challenge is. But I think the approach is, I would say, go to the board, see what the strategic commitment is, and then see how that's translated through. And I mean, to be fair, most frontline staff don't even know that Safeguarding Adult Boards exist and have the statutory duties and powers that they do under the Care Act. Why would you? I've gone out on where I chair boards and talk to frontline staff, because I think they ought to know that there is a board in their locality with the key partners on it that has duties and responsibilities at a strategic level for safeguarding practice. But I'm not sure that many practitioners are necessarily aware of what the role and responsibility of Safeguarding Adult Boards is.
But that's a point. Just on one of the other questions that we're going to ask about the report, I'm just getting a message from Mike, who was unable to connect. I think there's some technical problem that he wasn't able to get in. He's making the point that actually the system changes needed are not, as you said, they're not huge. This is more about a mindset change rather than some sort of massive upheaval, getting IT systems to talk to each other and things like that. Lindsay, do you have something to comment on that question?
Yeah, and it actually links to Mike's comment as well, because I think one of the main challenges in terms of partnership working all round, not just in safeguarding adults, is that shared understanding of each agency's priorities, but also each agency's approach to risk taking as well. And I know from hearing from practitioners that can be really challenging when you are working with a person who might want to take risks, which some professionals might not feel comfortable with. And one example of that, which I quite like, just to bring it back to real life a bit. So the example of a person who might have a learning disability who might be experiencing financial abuse or mate crime from mates who are always expecting that he buys all of the drinks when they go out. And maybe a more traditional approach would be to deem that those mates aren't mates, and all contacts ought be severed with them because they're clearly taking advantage. But what we found in the last evaluation was that there's a recognition that people really value the maintenance of relationships, and those may be, negative, challenging, tricky relationships where their friends or their relatives might be mistreating them, but still, friends and relatives. So being able to take that into account and work with people to develop the skills and the resilience to be able to protect themselves is a much more long-lasting approach to preventing future abuse, rather than trying to remove them from that social context. And that may take more time at the start because, working with a person on things like assertiveness skills, or knowing when to say no, or recognizing when people aren't behaving as friends should, takes time, but it's a much more long-term solution.
That's a great example, and I think that helps put it into perspective, this idea that this is about how we think about risk and the priorities that the service user brings. This is about the outcomes that matter most to them. In that respect, I wondered if, Adi, we could move on to thinking about service user engagement. And what your report has found about that, in terms of whether that be a local service user advocacy groups or voluntary agencies or whatever. What role is service user engagement playing in all of this?
So we were really interested in following this up because so fundamental to making safeguarding personal is the voice of the service user. And we focus very much on their voice and them being heard in the actual individual safeguarding process. But we were quite interested in asking the people that we were speaking with about service user engagement more generally in safeguarding. And it's very tricky because if someone's been through a safeguarding process and has experienced or risked experiencing harm and abuse, it's a very kind of normal and natural response to kind of think, I don't really want to get involved anymore. You know, once there's some resolution and recovery, I want to get on with my life. But in some places there's been, and in a few places what we found, that there's been some remarkable work done with service users or people who've been in contact with services around safeguarding experiences, who've wanted to spread very positive messages about accessing help, who've wanted to help raise awareness about the risks and how you might protect yourselves against the risks. And some really, really good examples of user groups and advocacy groups working on this area. We were, I suppose, quite disappointed that a lot of safeguarding adult boards, or a number of safeguarding adult boards, don't seem to be engaging with service users. And people were very honest in saying that they are often experiencing challenges in that maybe they'd had groups that they'd engaged with before but didn't now. But on the other hand, we were hearing some good stories about health watch organisations coming into this territory locally and providing that type of function. So it's quite a mixed picture. And one of the pieces of work we want to do at a national level is to try and do a bit more work in this area, because, as I say, it's so fundamental to making safeguarding personal that there is a engagement with the people who it really matters to, in working at a local or a national level to make a difference in people's lives. So it's a mixed picture, but it's something that I think we still would like to see if we can help people with, if we can, locally.
I suppose there are a lot of challenges because, not least because it's so variable from one area to another, how user organisations are involved, the extent to which they're involved, the channels that they're involved through. And at the end of the day, what we're talking about is something that is making practice person-centred. So there's kind of there's user involvement at both ends, but it's really the kind of the front end that this is all focusing on. So that would be interesting to see how that develops, and I guess a lot of it will be around communicating to these other organisations the nature of MSP and how it's different from traditional models. A lot of the organisations have arisen in response to traditional ways of doing practice, so they need to kind of share in the kind of, it's a sort of about completely different way of thinking about problems, isn't it? When you put the user first.
So hopefully, for example, advocacy organisations are absolutely on board with making safeguarding personal, because it's absolutely consistent with their ethos and practice as advocacy organisations. But you're right, I don't think that there's been maybe as much of a bridge made that there could be around this approach to practice. But as with, making safeguarding personal is a journey, and sometimes you don't know where the journey is going to lead you. But until you ask those questions, you don't know where that's going to take you. So we asked questions about user engagement, particularly in boards, and had some conversations with people about where there were areas of good practice, and in order to share that with other people through the temperature check report, so that if there is interest and resources and energy, resources by means people, that we can maybe help those people who want to take that particular aspect of the work forward. At the end of the day, we're trying to help people in their lives lead safer, happier lives, and whatever way we can do that, that's got to be our kind of fundamental aim, really.
Yeah, and well, really, because we did a piece of work in RIPFA which was based on a request that came in through a safeguarding adults board that we were working with, and they wanted to find out a bit more about what's being done nationally around involving people in safeguarding adults. And so we looked at numerous different types of involvement too, from involving people in practice when a safeguarding inquiry is being carried out about their circumstance, to providing good quality information and advice to people, which explains what safeguarding is, which AD's mentioned, is one of the sort of priorities now, to how to engage broader communities with the issues of safeguarding, and also how to sort of bring the experiences and feedback that people provide about their safeguarding experience and outcomes to sort of constantly improve practice. And one thing we really noted was it needs a real commitment and drive from staff who believe in this way of working, because it needs proactively reaching out to groups who may not often be heard, who may have quite strong views, but may also need support in communicating those views in various ways. And it's, yeah, as AD mentioned, it's much more of a mindset change than a thing which needs a vast amount of resource. But to really reach a stage of true partnership, it needs that recognition of a shift in power, which will be needed too, which will be a big shift.
Yeah, I mean, that seems to be, all comes back to having very committed champions, it seems. Lots of senior, high-level local support. And one of the questions I posed, which Mike has answered in a message, was around that, about how, what can local authorities do to try to develop the culture and to support people who are taking the lead like that. Mike has commented that they need support, they need development opportunities, job swaps across teams to help spread the ethos from safeguarding teams outwards. AD, is there anything else you would add to that in terms of how we keep the momentum going with this culture change?
So I think I was really impressed in the coaching conversations of the level of innovation and enthusiasm from people, majority of whom were real champions for this approach. So whether it's casework discussions at team meetings, or whether it's training or development, or whether it's about thinking about how to do things differently, or working in particular areas of practice, or, as I said earlier, working with sort of some of the least usual suspects like care homes or housing officers. Depending on what the current challenges are in any particular place in terms of their local issues around safeguarding and around improving practice, people are very committed to thinking about all sorts of different ways of promoting this different approach. And because it is an approach, it's not a specific, held, tied up thing. It can go anywhere. So one of the kind of practice pushbacks that I've had more recently is, and it does appear, we do talk about it a bit in the temperature check, is a kind of facile understanding of what the approach means. So if somebody says to you, no, I don't want you in my life, or slams the door metaphorically or absolutely in your face, and if you think about people who are described as self-neglecting and hoarding, that's the type of, that might help to think about the sort of person who wants to push any intervention away. Making safeguarding personal isn't about walking away. It's not about saying, well, just because somebody says, I don't want you here, you somehow forget any sort of professional curiosity, as Michael Preston Chute calls it, to think maybe, well, why are they doing this, and what is this about, and why, what else, what different ways might we think from helping this person manage the risks in their lives differently. And that's a very different way of working. So, as I say, making safeguarding personal isn't always about just listening to the words that somebody says, but understanding what might be going on underneath those words. And there's situations like domestic abuse, like self-neglect and hoarding, where you wouldn't just walk away because somebody says, no, I don't want any help, thank you very much. You've got to think about different ways of working. So those situations are quite challenging anyway, but having an approach that comes with person-centered and outcome focus is a way into those areas of work as well. But people are discovering that and have to learn that and think about it and work with it around each individual case, because it's person-centered, and think about what are the outcomes that that person might be trying to achieve and how best to support them. So you come back to those principles time and time again in practice, regardless almost of what it is you're dealing with, to help work through and get support to manage those situations. So I think the coaching conversations were quite inspirational. Coming back to your question, people are finding lots of different ways with no resources to help everyone who they work with think differently about their approach to practice. And it is quite fundamentally a learning experience, a learning journey for all of us, in terms of where this is taking us and what it's doing.
Well, that's brilliant. Perfect timing. It's 8 o'clock and we're coming to the end of our slot. I think a couple of things really stood out for me from your report. One was the finding that MSP, once implemented, doesn't cost you anything more. It doesn't take any longer than what people are doing currently. So there's the usual lack of resources issues shouldn't ultimately be a barrier to implementation, because it will make your practice more streamlined. And the other one was that this is very much aligned with core social work values, which is just sort of what you were sort of alluding to, the point you were just making, that this sort of people get permission to engage their professional curiosity in perhaps a more creative way than they had in the past. Is that a fair summary, you think?
I think both those points are very well made. I would say for people who are listening who aren't social workers, that this is about professional, a range of professional skills. And one of the things that we've heard back from people is that this way of working values professional skills from different professions, but certainly social work. And that, I think, is really important, because it is about understanding and managing and supporting people around risk, which is around using professional judgment in a number of different types of ways. And so hopefully people who are working in this way feel more, feel better about doing work in this way, because this is not an easy area to work in. I always start off when I talk about making safeguarding personal is acknowledging that adult safeguarding is probably one of the most difficult areas for professionals to work in. It's, the people we're working with are distressed, upset, angry, have had really often quite awful things happen to them. It's shocking. It's not an easy place to be with someone going through that in terms of your relationship with them and trying to help them deal with issues that are so difficult. So it's not an easy area for working, for anybody to work with. We need to be, hopefully we are with making safeguarding personal, making it an area where people at least can get more job satisfaction, as it were, from feeling at the end of the day they've helped somebody achieve something in their lives, being able to protect themselves from harm and risk on an ongoing basis, because we can't be in people's lives 24 hours a day. That's not feasible. So surely it's better to be able to help people help themselves. Fundamentally, that's what most professionals, I think, are trying to achieve.
Thanks very much. Any closing remarks, Lindsay, before we sign off?
I'm all right, actually. I think AD closed beautifully, so yeah, I'll leave it there.
I think so too. Well, thanks everyone for taking part, and thanks to everyone who's watching. As I said, we're going to embed this in a blog on the Social Care Elf, so the conversation doesn't need to stop here. But yeah, I'd like to say a very special thanks to AD Cooper and Lindsay Pike. A sincere apology to Mike Briggs, who's we weren't able to get him on the call, but we were able to relay some of his responses on some of the questions that we got from Twitter. So let's keep the conversation forward to the next temperature check in 2018, which will no doubt show it up in the red. But it's a very, I agree with your comment, this is a very positive report, and it's hopefully provides a lot of inspiration for people in taking person-centred care forwards. Thank you very much.